Hi, Dr. Stacy Grossfeld. I want you to take a look at this x-ray and tell me all the different things you see that are abnormal. And I'm gonna have you, we'll go to each section and then we'll kind of back up with the camera and I'll go over what the different pathology is. So this is a hip x-ray of a 72-year-old female who I saw in the office today. And let's start with what's going on here. What is abnormal about this area of the x-ray? So that's number one. Now move your eyes up to this portion of the x-ray. What is going on here? That's number two. Then let's drop down into this portion of the x-ray. What do you see here? Now we're going to drop down into this portion of the x-ray. What is this structure? And this is if you're really an Olympic x-ray reader, what is going on here and here in this x-ray? All right, so now I'm going to kind of go back. We're going to look at the x-ray again, and I'm going to tell you all the pathology that we're seeing. So we're going to start with the patient's left hip. She has end-stage arthritis. You can see there's no hip joint here at all, and you can see the sclerosis on the superior aspect of the acetabulum and the superior aspect of her femoral head. Now, there is this line that goes through here. So does this patient have an intertrochanteric hip fracture? No. This is a skin fold line. You can see it goes out into her soft tissue, and there's continuity of the line through here, so that it's not a fracture, that is just a skin fold line. Now we're going to move up into this area of her spine. She has a severe scoliotic deformity involving the lumbar spine. In this area, you can see where instead of the spine should go straight up like this, it is curving out to the right side. Then we drop down into this area. This is her right SI joint. This is her left SI joint. And everything is kind of cattywampus here because of her rotational deformity from her scoliosis. She has severe SI joint arthritis on the right side. When we drop down into this area, this is a total hip replacement, not a bipolar, but a total because I can see the femoral head right here, and this is the acetabular component. And if you're really, really good at reading x-rays, this is osteolysis, where the prosthesis is actually loosening in the femoral canal. So this poor gal's got all kinds of problems. So good job if you're able to get most of those diagnoses.